and welcome to NHIS in a week. We bring you highlights of events within the authority and the scheme. My name is Vida Iduchumwa Boateng. In the headlines, NHIS kicks off 20th anniversary celebration with year-long activities. NHIA and USAID organizes training for internal and external clinical auditors. NHIS and WHO organizes regional conference on financing UHC and health security. Now the details. Dr. Mrs. Yapokia Baden, Deputy CEO in charge of Human Resources and Administration of the NHIA, touts the progress of NHIS in its 20th year journey at the International Conference on Inclusive Insurance held at Movenpick Ambassador Hotel in Accra. The conference was on the theme Exploring Partnerships in Digital Solutions and Data to Achieve UHC. Following an ambitious target of achieving 20 million active members by the close of the year 2023, the National Health Insurance Scheme 20th Anniversary Celebration has officially been launched at the La Palm Royal Beach Hotel in Accra. Unveiled on October 25th, 2023, the year-long nationwide celebration is under the theme Health Heroes 20 Years Strong, and this is to serve as a reflection of the NHIS significant contribution to providing financial risk protection against the high cost of healthcare services to all residents in Ghana. The board chair of the NHIA, Dr. NSKP Kwaku, in his welcome address, posited that the NHIS represented extraordinary achievements in Ghana's health financing history.
The Ghana National Health Insurance Scheme, now commemorating its 20th anniversary, represents an extraordinary achievement in our country's health financing history. As the current board chairman, I am humbled to reflect upon the historical evolution of this pivotal institution and its steadfastness to its progress. Let us revisit for a moment the genesis of the Ghana National Health Insurance Scheme, which was born out of a profound concern for the welfare of all residents in Ghana. 2 decades ago, Ghana took a visionary step by establishing this scheme as a symbol representing our collective devotion to ensuring universal accessibility and affordability of healthcare services, regardless of one's financial status. This paradigm shift has had an enormous impact and has positively influenced millions of residents. A notable accomplishment that deserves recognition include the transition from the laminated ID card to the magnetic ID card, and later the production.
The NHIA Chief Executive, Dr. Bernardo Koboy, recaps the NHIS achievements over the past 2 decades, emphasizing the role it continues to play in Ghana's healthcare financing.
We thank God Almighty for the 20 years. And we also thank visionaries like former President John Ajekun Kufuor. And there is a big lesson or reflection that we have to identify. There was a big problem at the time when he wanted to be president. But whilst it was a problem for most of us, he saw it as an opportunity. And can you imagine, in the problem of cash and carry, lied close to 5,000 jobs. I am part of those who are employed gainfully through a program which aimed at solving a problem. Lied over 5,000 jobs. In that same problem, lied access to health care for millions of Ghanaians since 2003 for when the scheme started. In that same problem, lied jobs for vendors, businessmen in Ghana, contracts, opportunities. In fact, in that same problem, lied prospects for our economy, because it's only a healthy population that can do well when it comes to the economy. One problem, so many opportunities. And at 20 years, that is our focus. That anytime a problem is flagged, we don't get upset, but we look at the opportunities that will show up in that particular problem.
The National Health Insurance Authority, in collaboration with the United States Agency for International Development, USAID, has organized a 2-day training program aimed at improving the skills and knowledge of internal and external clinicians on clinical and compliance audit, revised methodology and tools. The training program, which was held in Ebri, brought together a selected group of staff from the authority who serves as internal clinical auditors and some external clinical auditors as well. Still on UHC, with an increasing focus on universal health coverage by the year 2030, Ghana's National Health Insurance Scheme, in partnership with the World Health Organization, successfully organized the first ever 2-day multi-sectorial regional conference on financing UHC and health security at the La Palm Royal Beach Hotel in Accra. As powered by the NHIS and the WHO from October 12 to 13 of the year 2023, the conference was on the theme Overcoming Financial Barriers and Providing Financial Risk Protection, which marked the commencement of Ghana's NHIS 20th anniversary as well as the WHO 75th anniversary. Representatives from 30 health insurance agencies in Africa, finance ministries, and key developmental partners in the global health ecosystem attended the mammoth event. On to other stories. In a bid to strengthen healthcare services and foster relations with healthcare providers, the National Health Insurance Authority visited the La Polyclinic, one of the government hospitals within the La Dade-Kotopon catchment area. The visit, which took place in October, aimed to discuss potential partnerships and explore ways to enhance access to quality healthcare for NHIS members after the Polyclinic appealed to the authority to waive the adjustment of charges that arose from clinical and compliance audits conducted at the defunct La General Hospital and inherited by the La Polyclinic. About 260 selected staff of the National Health Insurance Authority in the Middle Belt of Ghana have attended a 4-day Trainer of Trainers program in the Ashanti Regional Capital, Kumasi. The participants, comprising public relations officers, client attendants, district managers, and regional directors, came from the Ashanti, Bono East, Ahafo, Western North, and parts of the Eastern regions, and acquired in-depth knowledge of good customer service and relationship building, communication, marketing, branding, and effective writing skills.
Funded by the United States Agency for International Development, USAID, the 5-year program strongly emphasized mass media interventions lined up to shore up the NHI's active membership that feeds into the global agenda of attaining universal health coverage by the year 2030.
We are not good because we are old. We are old because we are good. Are you confused? We are not good because we are old. We are old because we are good. We would have faded out if our impact on society had not been felt. That is why we have been 20 years, despite all the challenges that we go through. So I'd like to take this opportunity to urge you to be in the anniversary mood.
The National Health Insurance Authority Greater Accra office in September carried out a joint staff DEBA and blood donation exercise. As part of the corporate social responsibility, the blood donation exercise aimed at supporting the National Blood Bank to save lives. On the sidelines, there were free health screening and free mass registration exercises for the needy in the North Jowlu locality. This is how we wrap up this week's edition of NHIS in a Week. For details of these stories and more, do log on to our website www.nhis.gov.gh or follow us on all our social media platforms displayed on the screens. My name is Vida Educhimwa Boateng. Thanks for watching.